Let me just notify other people as well.
Okay.
Okay, so we are now live.
My headphones.
Okay, so let's start now. Assalamualaikum warahmatullahi wabarakatuh for everyone. So thank you for joining us for our fourth online webinar series. So tonight we are very delighted to present you our pediatrics trainee from Nottingham, Dr. Hamizah. Okay. Oh.
Oh.
So without further ado, I will give the floor to Dr. Hamizah to present on her presentations with regards to pediatrics training application in the UK.
All right. Assalamualaikum everyone. So I'm Hamizah. I'm ST1 in pediatric in Nottingham City at the moment. So I'll try and my best to try and kind of like share my experience and a little bit of anything that I know about pediatric application. Hopefully you'll find it useful today. So without further delay, so in a way, the specialty overview. So your main guide is RCPCH. They have a website. They are very, very useful. So you can get almost everything that you need about the specialty itself, how about the interviews, how the application, how the training, and even as a trainee, they'll tell you about things that you need to have. For example, how many mini cats, CBDs, or docs, etc., that you need to do in a year at different level. But in general, it is a run-through program starting either August or September, depending on local education, local HEE, health education. So for Nottingham, we start in August, but there are some centres, for example, I think Wales and probably somewhere up north, they start in September. But so it's either August or September where you start. And the training is divided into 3 levels of training. So level 1 is ST1 to ST3. In general, you have general pediatric based in acute settings. For Nottingham, you have to do at least 1 year of units, where 6 months of it would need to be tertiary units, and it's a 6 months rotation. So you have in the level 1, so you have in a way 6 rotations. However, those who have previous experience in pediatric can start at ST2, but it's the same application. I think you've probably already heard about it during your application. And then it will be at least 24 months of it for level 1. And then level 2 training will be ST4 and ST5. And according to RCPCH, you need to have 12 months of general pediatrics, 6 months of neonates, and 6 months of community pediatric as well. And level 3 is either you're doing, it's when you start as ST6 to ST8, and you need to do either general pediatric with special interest, or we call it SPIN, or subspecialty, where we call it GRIT. And some specialty, you need to, they merge between 2 different sort of the local HEE. For example, like East Midland, there's separate the north and south for the first 5 years. But if you're doing a GRIT, some specialty, you have to cover both north and south. But then it will be kind of like variable depending on the local HEE kind of like school. And then, as usual, with any other specialty, you need to keep up with your portfolio, and obviously you have exams as well. And for pediatric, you need to finish all your exams by SC3. So it'll be 3 papers and 1 clinical examination, but I believe you can carry it forward for about 6 months after SC3, but then it depends on local HEE as well. Hopefully that sort of makes sense of the specialty. And then in terms of personal experience so far, I've never done pediatric before. So if you've never done pediatric before, it's not really a problem. It's fine. You can do pediatric training. And currently I'm doing tertiary units, which is known to be very, very busy. So we're working 1 and 2 weekends. We have a 7-day or 8-day stretch sort of shift. And kind of like averaging 1 set of nights per month. However, despite it being very busy, the seniors are very supportive and very approachable. Sometimes they are the one who pointed out like learning opportunities. The good thing about pediatric training is they are very, very protective about teaching. They try their best to make sure that people can go to teaching. So for example, there are ones where I was on normal working day, and then they have like grand round, but it was super busy because obviously neonates, you kind of I was covering NICU at that time, and then they tried their best to make sure whoever's that's not needed on the shift to go to the grand round despite it's being a bit busy. So it is very, very good opportunity to learn for training. So yeah, so far it's very good. So anyone who never done pediatric, it is fine to start on pediatric, or just to try and apply for pediatric. And so yeah. However, if you've never done pediatric, I probably wouldn't recommend you starting with tertiary units. It's probably a lot nicer to get used to the general pediatric first, and later on start with tertiary units as a second rotation, or in ST1 or probably ST2. So yeah. And anyone who really knows that they wanted to do neonates, who really knows that they wanted to do pediatric, you can start revising for one of the paper, which is Foundation of Pediatric. I think it used to call as MRCPCH1A, which you can do it now as an F2, I think. So yeah, so you can start doing that even before going into pediatric. And should you pass it, or even if you apply, you can try and use it as commitment to specialty as one of your things for your application. So if you have any other questions, I'm happy to answer any live comments and later on. So yes, in terms of interview, you're going to have 5 stations. Everyone will start with safe prescribing task, where a calculator, BNFC, drug chart, and a pen will be provided. You have 10 minutes to answer the questions that are given. So make sure that you read the questions properly and use your time very well. They might say from experience, when I did the interview, I think I have to prescribe 2 medications. One is probably paracetamol and another one is antibiotics. But on the is it clip or the questions bit, they said about another antibiotics already been prescribed by a reg, so you just need to prescribe 2 medication. Make sure that you read the questions properly. Make sure you read on the age of the baby, because I think during my interview it was for neonates, and the baby was like, it's paracetamol prescribing, if I'm not mistaken, and you just need to be careful where they falls into the BNFC and which maximum dose is allowed. So you really need to time yourself very well during this. So in total, you have 10 minutes for this task, and you have 10 marks in total for this station. Then after this station, they'll bring everyone to the other 4 stations. So everyone will be standing in front of the other 4 stations, depending on where you're going to start. So everyone start with safe prescribing task and then go to the next 4 stations. So the second station is communication station, where you were given 2 minutes prior to read the scenario. Would be to kind of like interactions with patients, parents, or carers. And again, it is the station is for 10 minutes, and you have 40 marks. And for my interview, I've got a question where I think mum wanted to go home, but baby was it's not a baby. So her child was a bit unwell, but she has another children at home where she have to go and looked after. So you just have to kind of like try and communicate with them in terms of how to comfort her and things like that. So that's a possible questions. And I think some of my friends get a question about a mom who accidentally, a mom who has a toddler who accidentally had an overdose because she forgot to close the lid of the paracetamol tablet, and the toddler or baby kind of like gulped on the paracetamol and Calpol, and then managed to get herself an overdose. And then you just have to inform them that there is a health visitor who's going to investigate and visit their home. And then you're just trying to kind of like explore that and inform the mum about the situation. So that's the second station. And the third question, the third station is portfolio station. So this is the most interesting, I think, compared to other specialty, where you have a maximum 12 pages that you can bring to the interview. So And then after, again, you have 10 minutes where one person, there's going to be two interviewer in this station. One person would be looking at your portfolio, and another person would be asking you about your motivation and commitment to PEDS and what you think about the specialty and why do you want to do pediatric. And again, this station has 40 marks in total. And once, I think about halfway through or at some point, the person who's kind of like reviewing your portfolio will be asking you some questions as well regarding your portfolio. And again, it's interesting. It's only 12 sides of A4 paper, so you really have to choose well what you include or what you don't include into your portfolio. But it is really thin, so it is definitely just 12 pages. The fourth station is governance and reflective practice. So in this station, it's separated into two, where the first part is about clinical governance. So example of questions that you can get is adverse incidents, audit change in practice, or a difficult colleague. And then another half of the station would be a reflective station where they ask you any significant events from your career to date. And again, you have about 10 minutes for this station and total marks of 40 marks. So yeah. Last but not least, you have pediatric clinical thinking station. So I didn't have any pediatric training before, so don't be put off by the word pediatric clinical thinking. Technically, they are aware that some of the applicants never have any pediatric training, so the question can be answered in a way by people who never even have pediatric training. So you should be able to answer this. And again, it is 10 minutes station and in total of 40 marks. Hopefully that sort of answer the vague idea of how the interview sort of kind of runs. And then at the end of the day, they're going to ask you for any feedback and stuff like that. But yeah. So in terms of kind of like preparing for the interview, the key documents would be the pediatric level 1 applicant guidance for August 2020, and person specification is probably the things that you, obviously, apart from practicing to try and answer, or what if they ask you this question, what you can answer, try and get together with a couple of friends. This is another things where you could try and read through these documents, which is available on the RCPCH website before the interview, and try to sort of not really master it, but yeah, they'll tell you more about what they look into their trainees and how the day gonna run and what to expect after the interviews and stuff like that. So it should be very helpful. So and then last but not least, just keep calm. And then don't forget your documents, portfolio. I think you will need your passport and visa. I think that's the only thing that you need, but just double check before you go and make sure you go to the right place at the right time. And again, as I said, make sure you use time very well for safe prescribing station and read the question properly. And you can start practicing for the interview now. There is a good medical interviews book that I think that have a lot of example questions, and besides that, there is also a good website from one of the local there's one deanery that has example questions for different specialties. I used to use it, but I can't remember what's the website called, but you can try and search medical specialties interview example questions maybe, and then you can get together with your friends, try and answer for specialties in terms of what you're going to need to do. Anyway, so far that's it. And I saw there's already questions about example of evidence to include in the portfolio station. So because you only have 12 pages, what I did was I've put two, so I made my own CV, which is kind of included in 2 pages. So I've included whatever I've done. So if you were a member of Teddy Bear, or if Teddy Bear Hospital were in university, or if you've done elective in pediatric, or anything, tester days, just include everything, all the information in kind of like a CV. So maximum 2 pages for that. And then, so for another 10 pages, I just put some of the training that I've had related to pediatrics. So if you ever join any life support, neonatal, advanced pediatric, or European pediatric life support, then you can include them. Even if you don't have any kind of like pediatric specific things. For example, if you wanted to include audit or a presentation that you've done, that's absolutely fine. So that's also what I had as well, I think. I think one of my portfolio, I included a presentation where I think I presented on M&M meeting, and then just said, when they asked me, oh, what's my biggest achievement, I just sort of said, about that. And obviously speaking in front of consulting is not really my thing. So yeah, it's kind of like trying to get through that, and they accepted it. So yeah, just try and pick and choose anything that kind of like try and include as much as you can related to pediatric. But if you don't have any, that's fine. So I've tried and include one for every kind of like presentation, one for at least one for presentation, one for audit, one for teaching maybe, and any courses that you've done related to pediatric or anything like that. Hopefully that answers your question. Any other questions or anything?
Okay, thank you very much, Dr. Hamizah, for your brief and concise presentations on pediatrics training. I'm sure that we have several audiences tonight. I'm sure they all have some questions in their mind, but they might not. Maybe they will ask those questions later on. But I do have a questions from my side, which I'm sure the audience would like to hear as well. As everyone know, pediatrics specialty is a very specialized field of medicine. I will think of it similar to like psychiatry or obstetrics, where it's maybe nothing to do with medicine, and it's quite specialized in itself. So now you have explained a lot about what the things that you included in your portfolio. Do you have any advice? Well, because some of our audiences are currently doing their medical student years, and they are doing their FY1 and FY2 years. Do you have any advice of what needs to be done during these years to build up their CV towards the applications?
Okay. Yeah. So if you don't have any pediatric rotation, it's probably a good idea to do a taster days. So that I don't have any pediatric, as I said, I don't have any pediatric experience before. So I did a few days of taster days in pediatric. to help boost my CV. And then if you're in medical school, again, you can try, or you can be a member of Teddy Bear Hospital. They quite like that. And elective in Paediatrics. It is a little bit tricky to give an evidence if you've done it before, but I've included on my kind of like the 2 pages of CV that I've made for myself, because obviously you only have 12 pages, and they seems to be accepting it. They did ask you, as in, I think one of the questions on my portfolio station from the interviewer who was reviewing my portfolio, he was just asking me like, what have I learned when as a Teddy Bear member hospital? As a Teddy Bear hospitals members, and so yeah, so they did ask you any questions about what you included in your portfolio, but if you've done it before, so it should be fine. So yeah.
Okay. I think one point that I find really interesting is to become a teddy bear hospital member.
Mm-hmm.
I see them. I see this quite frequently in the hospitals. They hang up posters on the wall about Teddy Bear Hospital, and I'm
Mm-hmm.
sure everyone has looked at the same poster as well in the hospitals that they are working in. But how do we become the member of this Teddy Bear Hospital? Is there a contact person, or is there a national recruitment for this?
It's usually through university, so they have like it's just kind of like one of a club where where people kind of like get together, those interested to be pediatrician or just like kids in general. So it's usually university club where they go to reception or nursery, but kind of like schools every so often in the afternoon or in the evening to try and usually the aim is to try and reduce anxiety, seeing medical or dental professionals. So trying to get them to kind of like explore and kind of like try and answer any of their questions and try and get them to play, try and sometimes kind of like get together with them and try and play stethoscope with them, or try and pretending how x-ray works and things like that. So it is quite fun group. So yeah, I would suggest if you are in medical school to join them. It is quite therapeutic at times. Yeah.
Can you join them as an FY1 doctor as well?
Good questions. I'm not entirely sure, to be honest. Maybe a little bit more difficult considering that you have other commitments, but
Okay.
I don't know.
Okay, that's fine. Thank you very much for answering that questions. So we have another question here. So Kay asks whether it is a very competitive specialty.
I think last year it says 1 to 1.2 something. Like the competitive ratio is like 1 to 1.2 something. So not too bad, but inshallah you get through. But yeah, but they're really looking into trainees nowadays. So I would think it's not really that competitive, but yeah.
Okay. But I'm sure as you go along in this field, and once you reach the ST6 and ST8 level, to subspecialize, the path will become much more narrower, isn't it? I mean, there'll be more competitions.
Yeah, I think for you to do subspecialty, you'll have another interview. But in general, you were given in general it is a run-through program. So for for my case, I've only given the first 2 years, although technically when I'm accepting the post, it is a 96 months rotation because it's an 8-year program. But you only being told the first 2 years. Some hospital will give you the first 3 years rotation. So your level 1 training, where you're going to be, because obviously nobody going to really know whether are you going to pass the exam on the first round, etc. Hopefully everyone going to pass it on the first round, obviously. But usually they only give you the first 4 or 6 rotation, depending on the local health education. But if you wanted to subspecialty, for example, in Nottingham, so because I only know the first 2 rotation, as I go along, I'll have a meeting with my education supervisor, the TPD as well, and then we'll discuss in terms of like what's the plan, etc. And I think in order for you to subspecialize, then you have another interview, but otherwise it's still kind of a run-through program. And then you'll discuss with your supervisor in terms of like how to get through the year. If hopefully that sort of makes sense.
Okay. All right. Any other questions from the audience? Okay, that's fine. I will move on to my next question then. Obviously, if you want to specialize in one field, it's important that you know that you will enjoy every second, every moment you spend in that specialty. So, getting back to your experience, what is it that you enjoy the most with your pediatrics training and with pediatrics specialty generally? And what motivates you to pursue a job in pediatrics in the first place?
That's a very hard question. Well, not a hard question. It's not really a hard question, but it is quite philosophical in a sense that nobody really knows the future.
It's okay. If you can, just one sentence will be enough. I think it will give at least a general picture to our FY1 and FY2 doctor.
So for me, I really like kids. So I really enjoy being with them, and then I just feel I like the kids' sincerity. Like when they are unwell, they are really unwell, or they tell, or they show. They don't really kind of like pretend they're not well, if that makes sense. And in general, I just like kids. That's kind of like made me decide to do. Well, let me just be honest then. To begin with, I'm not entirely sure whether to do pediatric or medicine, because I know I don't want to be a surgeon for definite. So sometimes, in order to try and choose a career, you do it by a process of elimination. So that's what I've been trying to do. Because I've never had any experience in pediatric, I wasn't really confident to say that I really wanted to do pediatric. So in all honesty, I did apply for medicine as well. But when I've got the two, both pediatric and medicine post, I then sort of talked to quite a few people, and a lot of people suggested that working and studying in it's completely different. So as a student, I might really enjoy pediatric, but as working, I probably don't really like it as much. But then so far from my experience, I've enjoyed the working environment in pediatric, where everyone sort of gets together. Everyone is usually very welcoming, and they are usually very friendly. And that's why I kind of, and a lot of people suggested to me, there's only one way to know whether I like it or not is by doing it. So that's how I decided to give it a go. And so far, so good. So,
Okay, that's a very good advice, and I think that's a very realistic answer as well. You wouldn't know until you have been in that field for quite some time, and you learn throughout your journey, isn't it?
that's true. And some people change halfway through. It doesn't really matter as long as you do what you like, I think, anyway. But yeah.
Okay. Okay, so getting back to the audience questions, is it easy to do LTFT in PEDS? Are they supportive to help you through the training?
There is quite a few people who I've known that's gone to less than full time. Most of my regs are less than full time, and I have at the moment on my rotation, because obviously I'm just doing units, so I'm not covering general pediatric yet. So we have 8 SHOs, and we have 9 SHO, and 1 SHO is actually job sharing. So and there is 1 SHO who's currently full time, but she's going less than full time. So I would presume it's not that bad, or it's not that hard to go into less than full time in pediatric. So yeah, and I've known quite a few people actually that doing less than full time in pediatric outside of my current rotation. So yeah.
Okay. Okay. And the next question from Kay: do you only do pediatric on calls as an ST1, or do you do gen med as well?
Because the ST is specialty trainee, so I presume we only do pediatric. But again, as I said, I'm currently not really in pediatric in general. I'm more into neonates. So with the neonates in my hospital, because it's a tertiary neonates, we only covering neonates only. So we're not covering general pediatric. But I would presume we only do pediatric on calls as an ST1 because it's a specialty training, and you're not really covered to do any adults procedures. So I would presume you only do pediatric on calls. So yeah.
Okay. All right. I have 2 more questions for myself. I'm just going to go with the first one.
Okay.
What is the most challenging situations you have ever faced so far as an ST1 during your pediatrics training?
Good. That's a very good question.
Just to give our audience a good picture on the training itself.
Okay.
Not just the good side and also the challenging side, so that they can make up their mind.
Okay. So again, my answer would probably be a little bit biased because I've never done general pediatric before. So this is more kind of like neonate base. So for someone who's never done pediatric and then gone into neonates only, I would say the most challenging part is neonates is very, very different to adult medicine or pediatric in general. Even my friends who's doing pediatric at the moment, because I have quite a few friends who I sort of keep in touch, because when I was trying to decide whether to do pediatric or neonates, pediatric or medicine, and they said people either like it or hate it for neonates because of how different they are. The most challenging part is, I think, it is very, very busy rotation. And because when you're on call, you are covering neonatal intensive care, there's a lot of procedures that you're not really trained yet. However, they will try their best to make you hands-on and try and support you throughout your training, which is very lovely. And I've been told by my registrar that even a consultant has given all the registrar a message to make sure that all the ST1s are being supported for the procedures. Obviously, because SHO is like 3 years of SHO. So the procedures is very, very challenging, I would say. Even cannulating is very different for a newborn and for someone bigger, because obviously the angle is going to be different. They are more peripherally shut down when they're newly born. So I think the most challenging part is the procedure. And even but then everyone is very, very supportive. So I have a lot of regs when I said, "Oh, I'm really struggling with even the most basic heel prick," which is like heel prick is basically like taking bloods for patients. Is the way we do it is either heel prick or through lines like UAC. Even that simple procedures, because if you've never done it before, it's going to be challenging anyway, wouldn't it? And then there are times when I'm struggling to get bloods because obviously my patients is only like 400 grams, 600 grams. You don't really have much bloods, and then if the technique's wrong, you won't really get much. And then sometimes if they are just pulled peripherally, you just don't get enough bloods. When I go back to my reg and say, "Oh, I can't do it," they are normally kind of like okay with it and then try and teach me. So they are very supportive in terms of training wise. And even this is very lovely. There's once when I was like in the middle of teaching, but I was holding the delivery bleep. So this is the same teaching that's been taught twice, but I've never get to the end of it because towards the end, both times I've been holding the delivery bleep. Both times I've been called to go to delivery. And then there's the consultant that was there who suggested that she goes to a trial of forceps where it's normally only an SHO that goes to the delivery for that kind of delivery. And I don't think you get that in other specialties, a consultant offering themselves to go on your behalf so that you go to the teaching and not missing the ending of the teaching. So they are very supportive. You'll get a good teaching time, and yeah, I'm sure you're going to love it. If you don't like neonates, just persevere. Pediatric will be different. But I can't tell you for sure because I've never done it before. So yeah.
Yeah, interesting to hear. So despite the challenges, it's good to hear that most seniors in pediatrics training are being supportive to their junior trainee. So that's a good point. Okay, so this will be my last questions if there's no more question from the audience. I'd like to know about are you aware of the how to be gazetted as a specialist pediatrician in Malaysia? Let's say in your case as a trainee in the UK, if you, let's say halfway through you decide to go back home and you want to apply uh, to become a specialist pediatrician in Malaysia. Are you aware of what will be the requirement from the NSR? Do they require you to have certain number of years of training? Do they require you to have passed your exams? Any idea on this?
In all honesty, the answer would be no. But I presume it's probably similar to what I've heard about medicine. But again, I didn't check how true this is. So I would presume you need to pass all your exams, and then you can try and apply as a junior specialist or something like that, and then have to work for another 2 years, I presume. But again, this is only an assumption. Pass. Not really sure the answer.
Okay, that's okay. yeah, just for the attention of the audience, if you would like to know more about this pathway, I think you can try to Google NSR Malaysia website, which I think they will give you a list of all the requirements that you must possess before you can apply. Yeah. All right. Any other question from the audience? That's fine. So I take it as a no. So yeah, thank you very much, Dr. Hamizah, for your willingness to explain to us in depth about the pediatrics um, training program in the UK. We really appreciate your talk because it's quite hard to find um, a pediatrics training, to be honest, to be able to give us a talk like this. So we wish you all the best for your journey ahead,
Thank you.
and I'm sure you will become a good pediatrician in the future. And also, thank you very much for all audience. Yeah, and it has been very insightful as well. Thank you.
No.
So we do have contact number for Dr. Hamizah. So if anyone wants to ask further questions, or if by any chance someone comes with interesting questions that need to be answered tonight, you can just email us, and we'll forward those questions to Dr. Hamizah. And only if Dr. Hamizah don't mind
Yeah, that's
us
fine.
doing that. Okay. All right. So thank you very much again.
No worries.
So yeah, thank you very much. I'll see you guys again in the next online webinar session.
Yeah. Best of luck to anyone applying to pediatric. Welcome to pediatric. If you decided to join pediatric, hope we can work together at some point. Okay. Best of luck.
Okay. So best of luck as well. Okay. Bye bye. Assalamualaikum warahmatullahi wabarakatuh. Let's end our meeting tonight with Tasbih Kafar and Suratul Nas. Okay, and Assalamualaikum and good night.